Imagine spending like $36 billion to send patients to private doctors, but being too terrified to ask those same doctors to report if a patient takes their own life.
Right, which sounds completely absurd.
It really does, but why? Because you're afraid those doctors might just quit your network if you give them more paperwork.
Yeah.
I mean, welcome to the paradox of modern veteran healthcare.
It is a profound contradiction, honestly.
Hmm.
What you're describing is this complete blurring of lines between a specialized, federally protected medical system and just, the local civilian clinic down your street.
Yeah,
The
exactly.
boundaries are basically dissolving right in front of us.
And that is exactly what we are digging into today. So welcome to the deep dive. Whether you've served in the military yourself, or maybe you love someone who has, or, you're simply trying to understand the massive, complex systems that quietly run our country in the background.
Which they really do.
They do. And this week's exploration is a fascinating case study in what happens when really good intentions just collide head-on with bureaucratic reality.
Absolutely.
Yeah.
And we are looking through a pretty remarkable stack of sources today. We're pulling from the dispatches of the Veteran Voice Weekly, specifically covering the period from July 6th through July 12th of 2026.
Right, so very recent. And the mission for today's deep dive is to pull apart this incredible, almost unprecedented push to expand veteran care across the country.
Yeah.
But more importantly, we are unpacking the fierce and sometimes totally contradictory battles over how to actually pay for that care, how to manage it, and what happens to veterans when the broader economy starts to tighten.
There's a lot to cover.
There is. Okay, let's unpack this. Let's start with just the sheer mind-boggling scale of what the Department of Veterans Affairs is attempting to do right now.
Yeah, the footprint is massive.
It is. We are talking about a massive expansion. Since just January of this year, 2026, the VA has brought in more than 200,000 new healthcare enrollees.
Which, that is a staggering logistical achievement for just a 6-month window.
Oh, totally.
And they are actively stepping on the gas right now. They've launched this massive summer campaign. It's called Freedom 250, obviously tying into the U.S. 250th anniversary.
Right, the semi-quincentennial.
Exactly.
Right.
And we're looking at over 140 distinct outreach events spread all across the country at VA hospitals, vet centers, community hubs, you name it.
And what's really interesting to me is the messaging behind this push. VA Secretary Doug Collins is using these events to actively dismantle some deeply entrenched myths about the VA.
Myths that a lot of people still hold.
Yes. I always assumed, frankly, that the VA was strictly for people who were wounded in combat. Or, I don't know, maybe for veterans who fell below a certain income line.
And that is precisely the misconception they're trying to break right now. Eligibility isn't just, a single checkbox.
Right.
It's actually a complex matrix.
Yeah.
It's based on your specific service history, your income, your deployment locations, all these other factors. And the care itself isn't just about treating a specific service-related injury either. Enrollment unlocks this massive preventative network.
Which is huge.
Right. It connects you to prescription coverage, routine checkups, and crucially, mental health care.
Well, and the results of this push are already visible in the sources. The data shows over 500,000 completed or scheduled appointments generated just from this recent push alone.
Yeah, it's working.
It is, and that includes 60,000 mental health visits, which is incredible.
Absolutely.
On top of that, they've actually managed to push their disability claims backlog down below 70,000.
Wow.
Which, according to the text, is the lowest it has been since 2020.
Right. And for a veteran who's, trying to navigate life without private insurance, just getting through that door is life-changing.
No, for sure.
But here is the structural paradox we mentioned right at the start.
Right.
The VA is pushing harder than ever to get people into their system. But increasingly, that system doesn't actually look like a traditional VA hospital.
It doesn't.
No, it looks like a private clinic in your local neighborhood.
And the financial footprint of this shift is it's difficult to even comprehend. Last year, the VA spent $36 billion with a B on private medical care outside their own walls.
Through the community care program.
Exactly. And they currently have 8.62 million veterans enrolled in this external network.
That's a huge chunk of the population.
It is. That level of spending makes the VA the fourth largest healthcare payer in the entire country, just in terms of paying private civilian doctors. Texas, Florida, and California are actually leading the entire nation in this spending.
And, to understand how we got here, you really have to look at the legislative engines that built this reality.
Okay, take me back.
So the foundation was the 2018 Mission Act.
Right.
And that was followed more recently by the 2025 Elizabeth Dole Act. And the underlying mechanism of these laws is actually pretty simple.
How so?
Well, if a veteran needs care and the drive to a VA facility is just too long, or maybe the wait time for an appointment is deemed unacceptable, the bureaucratic wall drops.
They just get to go somewhere else.
Exactly. They are allowed to go to a community doctor, and the VA picks up the tab.
Okay, let me make sure I'm wrapping my head around this structure. Because the VA spent a record $101 billion on direct care inside its own hospitals, right? Completing something like 82 million internal appointments. So they are operating as this massive flagship hospital network, but at the exact same time, they are operating as a colossal insurance company spending $36 billion in the private sector.
That's a good way to put it.
It's like building the world's biggest, most state-of-the-art gym, but then also handing out $36 billion in gift cards for people to just go work out at their local neighborhood gyms instead. I mean, why duplicate the effort on that scale?
What's fascinating here is the sheer geographic reality that's forcing that hybrid approach.
The geography.
Yeah, you simply cannot build a massive flagship VA hospital in every single rural county in America. It's impossible.
Sure, that makes sense.
So the VA has to balance its own internal capacity. And keep in mind, they're training 124,000 health workers a year with the immediate physical locations of the veterans who actually need them.
Like the rural pilot program they mentioned in the sources?
Yes, exactly.
Yeah.
Consider what they're testing right now in Shiprock, New Mexico, out on the Navajo Nation. The VA has placed 34 medical residents across 5 rural sites there, and they've already treated over 1,400 patients.
Wow.
They're literally practicing street medicine. I mean,
Yeah.
they're physically packing supplies into vehicles and driving out to veterans who just cannot practically commute to a clinic.
That's amazing.
There's this brilliant quote in the text from an Army veteran named Virgil Wood. He simply says, "I like it here and it's close by so I can get treatment."
Yes, simple as that.
Right. Sometimes the most advanced medical care in the world is completely useless if the patient has to drive 4 hours to get it.
Which makes perfect sense on a human level. But, when you rely on that local neighborhood clinic, when you lean on private partners to the tune of $36 billion, you still have to pay the invoice.
Always.
And that massive demand for cash leads directly to our next topic, because it is causing a massive collision in Congress right now over how to foot the bill and how to hold those private partners accountable.
Right. Because budgeting at the federal level is, well, it's a brutal exercise in zero-sum math.
Yeah.
Expanding care costs money, and the mechanisms for finding that money often require incredibly painful trade-offs.
And before we get into the specifics of these bills, I need to make a crucial note for you listening. We are diving into some heavy political battles here, but we are remaining entirely impartial.
Absolutely.
We are not taking sides. We are simply conveying the viewpoints from the source text to help you understand the landscape.
Just reading the map.
Exactly. So let's look at the Take Care of America's Veterans Act. This is a behemoth piece of legislation currently sitting in the Senate.
Yeah.
It is a 62-bill, 554-page package.
Huge.
The core objective is to fund serious injury benefits, specifically incorporating something called the Major Richard Starr Act. But because of those congressional budgeting rules you mentioned, to pay for these new serious injury benefits, they have to pull the money from somewhere else.
Right, and the mechanism they've proposed for that offset is highly, highly controversial.
Extremely. The bill proposes cutting future disability pay for tinnitus, which is chronic ringing in the ears, and sleep apnea.
Yeah.
They want to cut that specific funding by up to $57 billion over 10 years, which would affect an estimated 1.5 million veterans moving forward.
And this is where the veteran advocacy community just completely fractures. I mean, you have major organizations basically forced to take opposing sides on a bill that is ultimately designed to help the people they represent.
Yeah, it's heartbreaking. You have the American Legion, the Wounded Warrior Project, and the Elizabeth Dole Foundation backing the legislative package.
Right.
Their argument is that these funds absolutely must be unlocked for the most severely sick and injured veterans. But on the other side of the aisle, the disabled American veterans and the veterans of foreign wars, the VFW, are fiercely opposing the cuts. Carol Whitmore, she's the national commander of the VFW, articulated their stance perfectly.
What did she say?
She stated that a grateful nation pays its debts to veterans and, quote, does not send them the invoice.
Wow. And you truly understand why tensions are so high when you look at the human stakes of these funding fights.
Totally.
Consider another piece of legislation sitting in the Senate right now. H.R. 6047, which is the Shari Braley and Eric Edmondson Veterans Benefits Expansion Act.
Right. Named after a pilot killed in Somalia in 1993 and an Army sergeant severely injured in Iraq in 2005.
Exactly. And Sergeant Edmondson's family has provided him with around-the-clock care for 2 decades now.
20 years.
Yeah. This bill would provide the most severely disabled veterans, those who require what's called aid and attendance, because they physically cannot bathe, dress, or feed themselves without assistance. An extra $833 a month starting in December 2026.
I mean, put yourself in the shoes of a family providing 1447 care for 20 years.
That's unfathomable.
That extra $833 a month isn't just a line item on a spreadsheet. That is the grocery bill.
Right.
That is keeping the lights on. That might be a tiny sliver of respite care so the primary caregiver can just, I don't know, get a full night's sleep for once. The necessity of that funding is undeniable.
Absolutely undeniable.
But this brings us to a massive structural problem. When you push billions of dollars into private care to help these veterans, you lose visibility.
You really do. The oversight gap is glaring, particularly when it comes to mental health. The Fostering Trust Act of 2026, which was introduced by Representatives Min and Fitzpatrick, it highlights a terrifying reality.
Yeah, this part was shocking.
Veteran suicide is roughly 50% higher than the civilian rate. Yet, nearly 2/3 of those tragic deaths occur among veterans who receive all of their care from private community providers outside the VA walls.
And currently, those private providers are not required to report a suicide or a suicide attempt back to the VA.
Not at all.
Inside its own hospitals, the VA runs 2 separate mandatory reviews if a patient dies by suicide within 6 months of a visit. But in the private community network, 0 reporting requirement.
And the VA is officially refusing to back the Fostering Trust Act, which would force private doctors to report these suicides.
Wait, really?
Yeah, the stated reason in their testimony is fear. The VA believes that forcing community providers to take on this reporting requirement could push them to simply leave the VA network entirely.
So what does this all mean? Let me make sure I'm tracing this logic correctly.
Right.
We are boasting about spending $36 billion to send veterans to private doctors because the VA can't handle the geographic load.
Right.
But we refuse to ask those same private doctors to report if a patient takes their own life, purely because we're afraid the doctors will quit the program if we ask them to do the paperwork.
That's the logic.
I mean, that is like renting a car for a loved one to drive cross-country, but refusing to ask the rental company if the brakes actually work because you're worried they might get annoyed and take the keys back.
It is a staggering blind spot.
Unbelievable.
And this raises an important question, right, about the nature of compromise in these massive systems. You are watching a system stretch so thin that it compromises on fundamental oversight like suicide reporting just to keep private doctors willing to accept the VA's money.
Yeah, that is a dark reality. And I do want to pause here and say, if you or a veteran you know is in crisis, please dial 988 and press 1 or text 838-255. Help is available right now. But we really have to look at how this legislative gridlock and budgetary friction actually bleed into daily life. Because while Washington debates billions of dollars in offset mechanisms, the actual day-to-day economic livelihoods of veterans are taking a serious hit.
They really are. The labor data from this summer paints a very troubling picture. In June, the jobless rate for post-9/11 veterans jumped to 4.8%.
Yikes.
And the overall veteran unemployment rate also rose to 4.1%.
Though the one demographic bright spot was women veterans, whose unemployment rate actually dropped down to 3.6%,
Right.
recovering from over 7% back in March. But overall, the broader U.S. economy had a really dismal June, adding only 57,000 jobs total,
Yeah.
with the leisure and hospitality sector bleeding 61,000 jobs alone.
But the truly shocking metric here is what is happening within the federal government itself. Historically, civil service is the ultimate safety net and the employer of choice for transitioning service members.
It makes sense. They understand the bureaucracy.
Right, they have preference points in hiring, and it provides this nice buffered transition into civilian life. I mean, veterans currently make up about 30% of the federal workforce.
But that traditional safety net is vanishing. Between September 2024 and December 2025, federal veteran employment dropped by nearly 10%.
It's a huge drop.
That is 62,000 secure, reliable jobs just gone. The VA alone slashed 28,000 jobs in 2025,
Wow.
which is roughly 6% of its entire staff. And the source text points out the immediate local impact of this at places like Joint Base Lewis McChord in Washington state.
Yeah, think about that.
You have troops transitioning out of the military right there, stepping into a local market where the traditional federal jobs they would normally rely on are simply disappearing.
And if those veterans pivot away from the government and try their luck in the private sector, well, they are encountering severe friction there, too.
Oh, severe is putting it mildly. Look at the specific case of Warrant Officer Nathan Rogers. He is a 36-year-old pilot in the Hawaii Army National Guard, and he is currently suing United Airlines in Illinois federal court. Rogers claims that when he returned from active duty pilot training in December 2024, United denied him the 14-day return window that is federally guaranteed by USERRA.
Right, which is the law explicitly designed to protect service members' civilian jobs while they are deployed or training.
Exactly. And the legal mechanics of his complaint go even deeper.
They do. He alleges that United refused to count his military time toward his eligibility for the Family and Medical Leave Act, or FMLA.
Right.
And he needed that FMLA time to care for his wife, who was experiencing pregnancy complications. Because the airline allegedly wouldn't count his military service hours toward his employment total, he says he lost seniority, retirement contributions, and profit sharing.
Here's where it gets really interesting to me. We constantly hear the corporate and political talking points, right? Hiring veterans is a priority. It's stamped on every corporate careers page in America. But look at the actual mechanics of what we just discussed. The government itself is slashing veteran jobs at record rates. And one of the largest airlines in the world is allegedly nickel and diming a National Guard pilot over a 14-day window and FMLA eligibility while his wife is experiencing a medical crisis. The public relations spin simply does not match the reality of the paycheck.
If we connect this to the bigger picture, you can see the immense multifaceted pressure on a service member transitioning to civilian life today.
Yeah, it's intense.
They are stepping out of uniform into this really precarious dual-threat environment, a cooling private sector job market that is increasingly rigid regarding time off at the exact same time that the shrinking federal safety net is cutting tens of thousands of jobs.
It is a heavy, complicated reality. But before we wrap up today, we have to look at the other side of the coin.
There is some good news.
There is. Because despite all this bureaucratic friction, despite the budget fights and the economic squeeze, there are concrete community-level initiatives happening right now that are genuinely making veterans' lives easier.
Yeah, and quite often it is these highly specific, localized efforts that have the most immediate, tangible impact on a person's day-to-day stress levels.
Exactly. For example, if you are traveling anytime soon, the TSA just launched a new Veterans Ambassador Initiative in early July, again tied to the 250th anniversary.
Oh, that's right.
They have introduced TSA officers who are specifically certified as passenger support specialists.
That's fantastic.
Their entire job is to help veterans navigate the chaos of airport security, specifically focusing on those who use wheelchairs, wear prosthetic limbs, or live with PTSD.
Which is an incredibly vital service when you consider the environment. I mean, the TSA was expecting to screen nearly 18.7 million travelers in just the first week of July alone.
That's a nightmare, even without a service-connected injury.
Exactly. Trying to navigate that kind of overwhelming crowd can be incredibly daunting. Veterans just need to call the TSA Cares line at least 72 hours before their flight to arrange the support.
And as an added bonus, some disabled veterans even qualify for free TSA PreCheck now under the Veterans Expedited TSA Screening Safe Travel Act.
Which is great.
Right. It's a minor bureaucratic change on paper, but if you've ever stood in a 2-hour security line in the middle of summer, you know that is a massive quality of life upgrade.
Totally.
And looking far down the road, at the complete opposite end of the spectrum of care, there is a profoundly moving story out of Alaska. They just broke ground on the nation's northernmost state-run veteran cemetery.
The Interior Alaska Veterans Cemetery in Salcha.
Yes.
It's located about 30 miles south of Fairbanks, near Eielson Air Force Base.
And this project was funded by a $16.7 million grant from the VA. It sits on this beautiful 257-acre hilltop, and when it officially opens in late 2027 or early 2028, it will serve up to 12,000 veterans and their eligible family members.
It's been a long time coming, too.
Nearly 20 years of local advocacy for this specific site. Verdi Bowen from the Alaska Office of Veterans Affairs summed it up perfectly. He said, "Developing the cemetery ensures that veterans of interior Alaska have a final resting place close to home."
It really serves as a beautiful, quiet counterweight to all those massive faceless billions we discussed earlier.
It does.
These two distinct stories really represent the full spectrum of tangible care. You have the TSA initiative mitigating the immediate acute stress of daily modern travel, and then you have the Alaskan Cemetery representing the ultimate permanent act of honoring a lifetime of service within a local community.
I love that. It brings all of these massive legislative theories back down to humanity, whether you're just trying to get through airport security without a hassle or you're planning decades down the road for your family's peace of mind. Knowing that these specific targeted resources exist is, well, it's half the battle.
It really is.
So we have covered a massive amount of ground today. We started with the sheer logistical scale of the VA's $36 billion expansion into private community care. We navigated the agonizing, zero-sum legislative fights in Congress over funding major injury benefits by cutting sleep apnea pay, and we exposed those glaring blind spots in suicide reporting.
Yeah.
We looked at the real-world economic pressures hitting veterans from both a shrinking federal government and rigid private corporations. And finally, we found some quiet dignity in a new cemetery breaking ground in the Alaskan interior.
It is a vast and constantly shifting ecosystem. But looking at all of these pieces together, especially the massive reliance on private community care, leaves me with a lingering thought.
Okay, what is it?
With the VA increasingly relying on private networks to deliver care and private doctors actively being shielded from VA oversight like mandatory suicide reporting, we really have to ask, at what point does a veteran's healthcare experience become completely indistinguishable from civilian healthcare?
Wow.
And if that happens, do we risk losing the specialized, tight-knit community of care that the VA was originally built to guarantee?
That is the exact question we want you to mull over this week as you go about your routine. Take these nuggets of insight, keep questioning the mechanics of the massive systems operating around you, and remember that the blueprint is rarely as clean as it looks from the outside. Keep diving deep, and we'll catch you next time.